only mode. I'd like to and Wright. And
so welcome everybody to the webinar education series, Fall Prevention, Understanding the Risk Factors and Preventive Measures to Avoid Falls. I'd like to thank HealthCare and Capital Nursing Education for inviting me to this, to present this important topic. And this is a little bit about me. Started my nursing career in Denver and have been practicing in home health, acute care, and some long-term care as well as a clinical consultant. And so I've been involved with Capital Nursing Education for the last 3 years. And I'm very excited to be here to present this topic. Falls remain the leading cause of fatal, non-fatal injury for older Americans. Falls threaten senior safety and independence and generate enormous economic and personal costs. So it's really a national challenge and a very important topic. So in today's webinar, we're going to look at how falls impact the care system. We're going to look at making an accurate fall risk assessment. And we're going to go room by room to identify dangers in home. And we're going to look at the relationship between fall risk and incontinence. And then we'll share some community and educational resources with you. Some facts about falls. The Centers for Disease Control and Prevention reports that 1 out of every 3 people aged 65 and older fall each year. And every 29 minutes, an older adult will die from a fall. That's within the time that we will be together for this webinar. Every 29 minutes, someone dies from a fall. I think that's quite staggering. And 1 out of 5 falls causes serious injuries such as head trauma or fracture. So the CDC, the Center for Disease Control, and the National Council on Aging both have large data banks of information about falls, and we'll share some of those websites in a little while. What are other outcomes linked to falls? Well, we know that 22 to 30% of people who fall suffer moderate to severe injuries such as lacerations, hip fractures, and head traumas. And the most common fractures caused by falls are of the spine, hip, forearm, leg, ankle, pelvis, upper arm, hand, and pretty much any other part of the body that gets in the way. So short of being able to bull wrap, we are in danger of falling as we age. So let's talk a little bit about hip fractures. We know that hip fractures result in long-term functional impairments, quite often do. And a large proportion of fall deaths are due to complications following a hip fracture. 1 out of 5 hip fracture patients dies within a year of their injury. Treatment usually includes surgery and hospitalization, and hospitalization usually is a length of about a week, probably at a minimum, and maybe longer depending on other comorbidities. And it is frequently followed by an admission to a nursing home or an extended care rehabilitation facility. And 1 in 3 adults who lived independently before the fracture remains in a nursing home for at least a year after their injury, statistics show. So all of these factors are very apparent to me as a nurse, but also as the daughter of a 94-year-old woman who just lived this experience with her mother. And my mother was a lady who was very independent up until her final month. She was independent and driving in September of last fall when I visited. And shortly after I was there in September, she lived in a small town in Colorado. She fell on her sacrum and suffered a fracture of her sacral area, and but was discharged from the small emergency department home, not having them recognize that she had a fracture. And so she went home and started to deteriorate, couldn't get out of bed. So as the scenario goes with many of our elders, she ended up in a long-term rehab facility, and she did quite well. Twice the rate of men. And Caucasian women have significantly higher hip fracture rates than African American women. And over 95% help our elders be safe. 5% of hip fractures are caused by falls. So fall-related deaths, who's at risk? In 2013, the CDC has indicated that over 25,000 older adults died from unintentional fall injuries. Men are more likely than women to die from a fall, and after taking age into account, the fall death rate is approximately 40% higher for men than for women, which is quite interesting. And older Caucasians So you can in 2008, the Centers for Medicare and Medicaid, or CMS, identified falls and trauma as one of 10 hospital-acquired conditions, or HACs, for which Medicare will not cover. And as a result, many private insurance companies and private payers follow suit and guidelines are, and so they will not pay either. The National Quality Forum also lists patient death or serious injury associated with the fall as one of 29 serious reportable events. Now, the National Quality Forum is a nonprofit membership-based organization whose mission is to help providers monitor performance. And the NQF, the National Quality Forum, compiled a list of these SREs, which are serious reportable events. Care facility. In 2010, the acquired HAC reduction program to provide an incentive for hospitals to reduce HAC. And beginning in 2015, CMS is mandated by the Affordable Care Act to reduce hospital payments by 1%. Affordable Care Act established well, the same is holding true for hospitals in terms of falls, it looks like. In home health, and I think many of you may be different considerations for folks who fall at home. And of course, there are multiple factors, and many of reference. And Home Health Compare has information about the quality of care provided by Medicare certified home health agencies throughout the nation and can help us learn how well home health agencies are caring for their patients. So basically, Home Health Compare looks at best practices in care, and patients have improved. So in terms of falls at home, Home Health Compare looks at how often the home health team checks the patient's risk of falling and how often the patients got better at getting out of bed. And a lot of this information is gleaned from the multi-factor fall risk assessment that's part of the OASIS-C. And the OASIS-C refers to the assessments that are done when a patient is admitted to a home health agency. And it's not just for Medicare certified patients, Medicare patients, the private insurances are following OASIS information as well. So most home health agencies are involved with completing OASIS-C information. So let's talk a little bit about fall risk assessment. So here's a list, and it's a fairly thorough list, and there are some other factors as well, and we'll run through these fairly quickly here. A history of falls is particularly significant in terms of predicting risk for an older adult, as are changes in mental status, such as confusion, dementia, impaired judgment, or delirium. Of course, folks over age 65, and those folks with sensory deficits, such as visual or hearing impairment, can be at risk for falls. And medications are particularly important to look at. There are meds such as antihypertensives, diuretics, antidepressants, anti-anxiety meds, opiates or hypnotics. All of those kinds of medications can predispose a person to perhaps dizziness or some hypertension, and then put them at higher risk for fall. Are they able to ambulate independently, or do they require assistive devices? Some of those types of things may predispose them to falls. Do they have attached equipment? Do they have IVs, or do they have oxygen concentrators with tubing that's wrapped around their ankle almost all the time? And I've seen that many times in home health. That's one of those hazards that we really need to address. And other household safety hazards can lead to falls, such as weather conditions. I mean, gosh, how many people fall on ice or wet floors from coming in from the rain or whatever. So those types of things are just an alert to kind of watch out for. Or do they have a new kitten that they could trip over, or a puppy or a dog that might even knock them over? Some of those types of things we need to think out of the box a little bit in terms of protecting our older adults. And people living alone tend to be at more risk for falls. And incontinence. We're going to talk a little bit about incontinence in just a minute, but incontinence can also lead to a higher risk for falls, as can cardiovascular and respiratory diseases, any type of medical condition that would result in postural hypotension with dizziness. And let's talk really briefly about risk assessment tools. There are a couple, well, there are many of them out there, but I have recently reviewed a couple of them. And one, and I don't have the slides for these, but just know that you can Google them and get a lot of information on fall risk assessment tools from a lot of the websites that we'll show at the end of the presentation. But the Morris Fall Risk Assessment Tool is very research-driven and has been shown to be a reliable tool for predicting fall risk assessment. And it's a very simple tool to use. It has 7 risk factors, which include history of falls, secondary diagnosis, ambulatory aid, do they have an IV or a heparin lock, how do they transfer and what's their gait like, and mental status. So all of these items are scored according to the assessment of the patient, and then the final score is either high risk, moderate risk, or low risk. And as I mentioned, this has been researched, and so is evidence-based. And another one is the Hendrich Fall Risk Assessment Tool, and it's also very simple, yes or no questions, looking at some of the same factors as the Morris assessment, but this particular one also looks at altered elimination, so it would include the incontinence factor. So there are some really good tools out there. I would urge your agencies to take a look at some of those if you do not have fall risk assessment, but if you're a home health agency and you're performing or completing the OASIS, you probably are doing some fall risk assessment. The physical aspects of fall prevention, what are some of the things that our older adults can do? Well, it's been shown that regular exercise is very important to this whole issue of fall risk. It's important that the exercises focus on increasing leg strength and improving balance. And I know with my mother, that was one of the things that they worked on a lot, was her balance, because she has been having some dizziness over the years. Kind of comes and goes, but it was an issue. And so balance work was integral in her rehab plan care. And it's important that the exercise gets more challenging over time. And I know that Tai Chi is a very popular program, and it's offered very widely at different centers and gyms and private instructors throughout the country. Secondly, medication review. I can't stress that enough. There are a number of folks who are getting meds from multiple providers. So it's really important to look at the side effects of those meds, to identify prescription and over-the-counter meds that may cause dizziness or drowsiness or other problems that may interfere with ambulation and increase risk for falls. And then eyes. How are their eyes doing? They need to have an eye doctor look at their eyes at least once a year, it's recommended, and update eyeglasses to maximize their vision. And if they wear bifocals, perhaps progressive bifocals or trifocals would be better than the ones with the little lines. Sometimes those little lines in the actual lens itself makes it difficult to navigate outside if there are steps or uneven surfaces. Other physical aspects to lower their hip fracture risk. Older adults can look at their vitamin C level. A deficiency in I think I said C, I meant vitamin D. Vitamin D level, a deficiency may affect muscle function and balance, increasing the risk of falling. Weight-bearing exercise has been shown to be an advantage to fall prevention. And then screening for osteoporosis. You know, osteoporosis is not just a problem for women. It can also be a significant problem for men, such as those men who perhaps have a low testosterone count, and it tends to cause some osteoporosis. So screening is an integral part of the physical aspect of fall prevention. So let's go room to room, and we're going to start in our stairway. Let's do a stairway checklist. So many homes who have stairways leading up to the bedrooms or the living areas may have objects stacked on the stairs, the laundry that's going up, or the books, the magazine, whatever it is. Sometimes it gets stacked on the stairways. So keeping the steps clear by removing all shoes, books, and other objects from the stairs would be an important safety precaution. Is there any loose or torn carpet on the step? And it should be reattached, or perhaps even the carpet removed from the stairway, and those non-slip safety treads or safety tape can be applied to the step, which may be an added safety feature. And handrails. Are the handrails on both sides of the stairways leading up and down? And are they tight? Are they secure? They may have a handrail, but if it's wobbly, it's possible to get out of balance and fall. So a very secure handrail or two would be highly recommended for our older folks in the home. Is there a light over the stairway with light switches at the top and the bottom of the stairs? And the electrician may need to be accessed to put in a light switch, but there are those little pickup lights that might be useful if the elder can't afford an electrician, and I know that gets to be expensive, but it's also a lot more expensive to have a broken gate. So it may be worth the expense of hiring an electrician to make sure that the lighting is adequate in the stairway as well as in the whole home. Are the stairs easy to see in low light? And it's shown that painting a contrasting color strip on the top edge of the steps will make it slightly easier to navigate. Flooring. Is there a straight path through each room? Rearrange the furniture to create a straight path through every room. And throw rugs. Oh my, I've been teaching about throw rugs for a very long time, and they're still there, and people use them widely. And if you're using them, we need to make sure that the throw rugs are secure using double-sided tape or non-slip rug pads underneath to secure them securely to the floor. Many times I've seen throw rugs on top of carpeting, and it gets tangled up in tubing or walkers or whatever. So perhaps they need to do without the throw rug if they have additional carpeting, or if they have throw rugs on hard floors, then using the double stick tape or the rug pad would be recommended. More flooring checklists. Are there loose wires or cords? That's particular, oh my goodness, with the electronics that we have now and chargers and whatnot, very important to keep those out of the way, coiled up and taped securely next to the wall. And are there objects stacked on the floor? And boy, this room would be tough for anybody to navigate. And I'm a little nervous in this slide picture with all of the stuff on the floor. There's a little footstool and a TV tray with things piled up. Look like many of the home health patients I've seen over the years. In fact, I have cared for many folks who have boxes, cardboard boxes, stacked up in their house, and they can hardly navigate through. I guess it kind of keeps them safe from falling, but the fire danger is quite significant. But if they fell, I don't think they could get up to get anywhere if they could get up. So, and you know, people are going to do what people are going to do, but they do need to be instructed. And it's our job as healthcare providers to instruct them on these safety issues.
Anne, are you there? I want to stop you real quick. Your audio keeps kind of fading in and out, so just make sure you're talking directly into the phone line and try not to move. So.
Thank you. I will. Let's see if that's better.
Okay, great. Thanks.
Okay. Identifying dangers in the home, the bathroom checklist. Are there non-skid shower mats or safety treads in showers or tubs? Adding a non-stick or non-slip rubber mat to the shower or tub can be a huge help in terms of preventing falls. And grab bars. I can't say enough good things about grab bars. And as I am aging as well, I also love the grab bar. In fact, I'm thinking about getting grab bars as we speak, because they really are, as I'm getting older and my joints are getting stiffer, it's really nice to have the grab bar next to the toilet or and inside the shower or tub. And in the bedroom, is there a light right next to the bed? You can move the lamp closer so that there's a light within reach, or a flashlight. You know, growing up in the rural area of Colorado, we had power outages quite frequently, and so it wouldn't have mattered if the lamp was close. Having the flashlight with good batteries was really important to us to navigate. So, and I use the flashlight now so that I don't end up in the closet, because I don't really want to go there when I'm getting up at night to go to the bathroom. So, and then look at if there's a lit pathway between the bed and the bathroom, and night lights. I do have night lights in my house, and I know that that is also paramount for our aging population, to have well-lighted bathrooms and hallways. Is the house itself brightly lit? And I mentioned that before. If they need more lights, perhaps they need brighter fluorescence, and with this age of fluorescence, sometimes the fluorescents are a little duller. But now they're making more LED lights they're a little more costly, but they also put out a brighter light. And shoes, that's critical. Are shoes worn inside and outside the home? Wear shoes at home whenever possible is really important. Going barefoot or wearing socks really increases the risk of fall in the home. Now I'm going to talk a little bit about incontinence. Urinary incontinence is the unintentional loss of urine, the inability to hold urine in the bladder due to loss of voluntary control or the urinary sphincters resulting in involuntary passage of urine. Well, that's a long-winded way of saying that you have urinary accident or you gotta go, you gotta go. Incontinence episodes can lead to slips on wet floor surfaces. And in our elderly population, the need for frequent toileting and or urgency to void increases the risk of falls by 26% and bone fractures by 34%. Urge incontinence can increase the risk when a patient hurries to get to the toilet. And boy, I know that now, that urge incontinence can really make you hurry it up to get to the bathroom. Episodes of urinary incontinence can be transitory and often related to acute illness, such as urinary tract infection, that can then cause incontinence or delirium, some drowsiness, some hypotension. So that's also something to be aware of in terms of not only fall risk, but really a side effect of urinary incontinence, or a side effect of the urinary tract infection is the urinary incontinence. And medications used to treat incontinence, such as anticholinergics or alpha blockers, can cause postural hypotension or low blood pressure. And how many of our folks need to get up at night? Nocturia can result in poor sleep, which then is associated with increased fall risk. And you know, about a third of our folks who are aged 30 to 70 years of age experience loss of bladder control at some point in their adult lives, and about a third have to get out of bed 2 or more times a night to urinate. So you can see how important it is to look at incontinence, and then also look at the bathroom, to make sure that if they are getting up at night, that they are safe and at a minimized risk of falling. So what's the relationship between fall risk and incontinence? Some strategies to prevent fall risk. First of all, identify and treat the cause of incontinence. And just because a person is elderly doesn't necessarily mean that they have to be or will be incontinent. Sometimes medication side effects can promote incontinence. And we need to respond to toileting requests promptly, especially if the patient requires assistance to get to the toilet. And if we can, we need to locate the patient closer to the toilet. A bedside commode or a urinal may be a huge help to a person who has incontinence and who is at risk for falls. And implementing a toilet assistance program that best matches the patient's need and voiding pattern is helpful. Helping ensure the patient is wearing suitable clothes that are more easily removed by themselves or by the staff can help with those dribbles. So if they're dribbling, having something that they can get out of quickly to get to the potty may help keep the urine off the floor, which then would reduce the slipping risk. And then considering a non-slip mat on the floor beside the bed, secured with non-stick tape for patients who experience urinary continence when transferring from the bed. They might be less likely to hurry up so much if they know they have a pad. Same thing with wearing absorbent products, which is the last bullet on this slide. And keep the pathway to the toilet obstacle-free, and then a night light on. And then there's a huge amount of absorbent products out there on the market that folks can utilize to help manage incontinence, either urinary or bowel incontinence. Adult diapers or pads worn in the underwear are very useful to help catch the so that maybe they would slow down and then be at lower risk for fall. Okay, so we've covered quite a few topics, and there are a lot of community and educational resources out there. And I mentioned the CDC, which is cdc.gov, and the National Council on Aging, NCOA.org. Both of those sites have a lot of really good information, as does Caregiver Action Network, and the Shield HealthCare community website has good information about fall risk and prevention. They call it, and it's very colorful, and it has big font, and it has 6 steps to prevent a fall, and it goes 1 through 6, covering everything from finding a good balance and exercise program to talking to family members and enlisting their support for helping our elders stay safe at home. So that's a really nice tool that you can download from your work site. And then there is a National Falls Prevention Awareness Day. In case you weren't aware, there is one. It's coming up in September this year. And there's an initiative from the National Council on Aging, and your facility or your agency can participate in that, which would be really wonderful to raise the awareness in our community and with our caregivers to prevent falls. Some of the references used for this program today are listed on your screen. A lot of the data was from the CDC and CMS. Sage Journals also has quite a bit of fall prevention information. And the AHRQ, which is the Agency for Healthcare Research and Quality, has a toolkit for hospitals. So any of you folks who are working in acute care can access the AHRQ, and that site is not on this particular slide, but you may be able to Google that from your agency or your facility. Okay, and so with that, we will take questions. Are there questions out there?
Great, thanks, Ann. If you have a question for Ann, please type it on the question box to your right. We have several questions so far. A lot of them are regarding handouts. So will these handouts be available after the webinar? They will be available. Please contact your Shield HealthCare rep, or also we're going to post them on the community site. Also, this is being recorded, so if you missed any part of this recording, you can log on to shieldhealthcare.com/community, and this recording will be posted by Friday, I believe. So we got a question from Miriam. We have great fall risk assessment tools. Our issue is what to do about them. We have patients with CVAs, Parkinson's, Alzheimer's, with poor judgment, and we cannot be there at home 24/7. How do we work to prevent these falls?
Well, oh my, that's a big question, a good question. Not that there are any not good questions, but that is a very important question. You know, we can't be there 24/7. Even in the case of my mother being in assisted living, she fell during the middle of the day. So my answer to that is that I don't have any easy answers. I think as a facility we need to show that we've done our due diligence in education, that it's well documented, that we have assessed for risk. If the patient is at high risk, then what have we done about that? That we have taught to clear the pathways, or we've taught the patient specific factors related to that assessment. So if they are coming out at high risk, particularly in areas of, say it's an oxygen concentrator, that perhaps we've had the durable medical equipment company come out and look at the situation. You know, does the patient maybe need a backpack or a little carrier that they can shorten up the tubing? You know, any of the strategies that we've done to help them prevent falls. You know, it would be nice to prevent all the falls. I'm not sure that that it's going to be done, and I don't know that that's answered your question very well. But documentation doesn't necessarily keep the patient any safer, but it does show that what a facility or an agency has done to help prevent falls in the case that maybe they do fall.
Great, thanks, Anne. You mentioned aerial rug to the carpet. What will help stick an aerial rug to the carpet when they refuse to remove the smaller top rug?
I think that there's some double stick tape that has a lot of adhesive, and it'll stick for a while. And some of the little rugs that they have more foam backing, and maybe it would be useful. That memory foam stuff kind of stays down. It's a little heavier. Might be a little more useful than the little washable type. You toss them in the machine, throw rugs. But I think the double stick tape does help for a while. It may need to be replaced as the carpet fuzz kind of clogs up the adhesive. But other than that, and there may be some other resources if anybody knows of some and wants to share on your chat box, that would be great. Thanks for the question.
Thanks, Anne. Can you talk a little bit more about the importance of fall prevention?
To change people's behaviors, but what we do need to do is make sure that they can verbalize back to us what we have taught them in terms of clearing the pathway or containing the 55 wires that they have leading from their recliner over to the television or whatever. So just going through, like I mentioned before, item by item in terms of their fall risk assessment, and then showing what we've done to teach them in the home would be my best advice.
Great, thanks, Anne. In your clinical experience, are home health professionals not performing enough fall risk assessments on their patients?
I'm sorry, could you say that again?
In your clinical experience, are home health professionals not performing enough fall risk assessments on their patients?
I can't answer that. I don't know what other agencies are doing. I know when I did health, we did look at fall risk, probably not as closely as it's being scrutinized now, but I can't speak to all the agencies out there because there's a lot of home health agencies in the world. But I think that if a home health agency has a checklist for fall prevention for the patient and caregivers, and this also goes back to the question right before this, what can home health agencies do? I think in addition to documenting what they have done to address fall risk, leaving a checklist with the patient, caregivers, or with the patient, and even in an agency I worked at before, we had them sign it so that, and we kept a copy in their record at the office. So to answer the listener's question about what other, if home health agencies in general are doing enough fall risk, I don't know that specifically.
Great, thanks, Ann. I think that's all the questions we have. I'd like to thank Ann Rice for her great presentation. Again, if you missed any portion of this presentation, you can go onto shieldhealthcare/community for the recording. Also, contact your Shield Healthcare reps. They will have a copy of these slides as well. Again, I'd like to thank Capital Nursing and Ann Rice for the great presentation. Our next presentation will be on home health agency ratings in June. Look out for that. Again, thank you everybody for attending this webinar, and have a great rest of your day. Thank you.
Thank you, everybody. Stay upright.